tonight's health alert, new warnings about a major measles outbreak that we've seen happening in some parts of the country. WRG's Alex Coleman talks with health experts about why they're concerned about the highly contagious virus.
With spring break just around the corner and as many students and families make plans for their travel destinations, there is concern about a measles outbreak in the U.S. Dr. Sandy Arnold is the director of infectious diseases at Le Bonheur Children's Hospital.
I think everybody should be concerned about measles. It's a disease that almost everybody used to get, but was associated with about a 5% risk of death, especially in young children. So we should all be concerned.
The measles outbreak has grown to at least 124 cases, prompting questions about how to stay safe. The outbreak is primarily affecting children and teenagers in Texas, nearly all of whom were unvaccinated, and health experts say one child has died. 9 cases have been reported in New Mexico. But what about here in Memphis and the Mid-South?
There was one case in the state of Tennessee in 2024, and there have been no documented cases in Tennessee thus far.
Measles is one of the most contagious infectious diseases, but doctors say the measles vaccine is highly effective and safe.
Vaccine works extremely well. About 85% of people respond to the first dose of vaccine. Everybody is required to have 2 doses because with the second dose, that bumps up to 95 to 98%. So it's highly effective in inducing immunity. And once the immunity is induced, you have lifelong protection against measles.
And as many make plans for spring break, Dr. Arnold says taking precautions by protecting yourself with the vaccine is the best preparation.
I think that if you're not traveling to a place where there's known to be an outbreak, I think that you're fine. But again, always making sure that everybody's vaccines are up to date.
Reporting for your news leader in Memphis, Alex Coleman, WREG TV, News Channel 3.